Hi, my name is Marta Wilson. I'm a research manager and lead data analyst at Brown University.
And my name is Jiwon Park, and I'm an assistant professor in epidemiology at the University of Delaware and an adjunct assistant professor at the Brown University School of Public Health.
We're here to talk about our paper entitled Multilevel Resilience and Appointment Attendance Among African American Black Adults with HIV, a Prospective Multisite Cohort Study. We know that attending clinic appointments helps support HIV viral suppression. However, Black adults in the US are more likely than white adults to miss scheduled HIV clinic appointments, which contributes to observed racial and ethnic disparities in HIV outcomes.
The literature suggests that resilience resources which help promote positive biobehavioral adaptations in the face of adversities may be important for improving HIV appointment attendance. However, there's limited evidence as to whether resilience resources can improve current and future appointment attendance among Black people, especially those living in southern or less urban areas of the US where HIV diagnoses are highest.
In this paper, we used data from African American and Black adult patients enrolled in clinical cohorts at the University of Alabama and the University of North Carolina to examine whether endorsement of multi-level resilience resources was associated prospectively with HIV appointment attendance. We looked at associations overall and by levels of neighborhood crime and disadvantage.
For our HIV appointment attendance outcomes, we used visit adherence, which was a non-repeated binary indicator of attending at least 87.5% of scheduled clinic appointments with a primary HIV care provider during 12 months of follow-up. And we also used clinic attendance, which was a repeated measure of attending scheduled appointments.
The primary exposure was a time-fixed measure of endorsement of multi-level resilience resources based on responses to the validated 38-item multi-level resilience resource measure at enrollment. Measure items ask respondents how well a resilience resource helps them continue HIV care despite challenges or describes their current neighborhood.
For our analysis, we used modified Poisson regression models to estimate risk ratios for visit adherence as a function of binary or tertile measures of multi-level resilience resource endorsement. For the repeated clinic attendance outcome, we first created two 6-month intervals for each participant using the furthest outcome within each interval. We then used modified Poisson models fit with generalized estimating equations and accounted for outcomes clustered within census tracts. In our final sample of 291 participants, the risk ratio for visit adherence comparing greater versus lesser resilience resource endorsement indicated that a positive association was most compatible with the data. We also found that a negative association between greater resilience resource measure endorsement and repeated clinic attendance was most compatible with the data. There was no strong evidence of effect modification by neighborhood risk factors.
Some limitations of this study are that the 12-month follow-up period may not fully capture longer-term appointment attendance behaviors. Also, our outcomes excluded rescheduled appointments, which may be related to resilience resources. Also, our study population was highly engaged in care at enrollment, such that our findings may not be generalizable to other less engaged populations.
Ours is one of the first studies to evaluate HIV appointment attendance as a function of multi-level and level-specific resilience. Future research should explore the long-term resilience appointment attendance relationship among persons who are less engaged in care.